Hi, I'm Dr. Shreepal Jain. I'm a senior pediatric cardiologist based in the city of Mumbai, and I'm practicing at the Bai Jerbai Wadia Hospital for Children and have been in this field since the last 16 years. Right. So, as far as treatment for congenital heart disease is concerned, so you can broadly classify them and into two different scenarios. So, one is what we call in general or layman language as open heart surgeries, right? So that's one. And second is something what even common people will say that laser or endoscopic or minimally invasive. So these are the two broad categories. Of course, the third category is something where there is no treatment required or where something we can manage only with medicines. So coming to the first aspect, which is open heart surgery. So there are still a lot of congenital heart defects which require open heart surgeries. So especially if there is a large hole in the heart, or if there is a hole in the heart along with blockage of one of the arteries, or if one of the arteries is missing, or if the arteries are interchanged. So these are some of the situations where the child will have to undergo an open heart surgery. Now fortunately, most of these heart defects can be corrected for good, and they might probably require just once in a lifetime surgery, especially the holes in the heart. So that's as far as open heart surgeries are concerned. Of course, there are also some heart problems which may require repeat surgeries in the future, but still having a good long-term outcome. On the other side, we have certain heart problems where we can correct them with the help of or minimally invasive surgery, which, as I mentioned, that common people call it as laser or endoscopy and stuff like that. So essentially what we do is we go via these small veins or arteries in the leg. We enter the heart and then we kind of close certain holes. We open valves with the help of balloons, or we put in stents. So where there is no scar involved and the recovery is much faster. Third, as I mentioned, there are certain heart problems which require only medicines, or certain lesions which may recover completely even spontaneously. So those are the problems where we just keep those children on follow-up. So broadly classified, these are the three aspects how you can manage a child with a heart defect. Right. So in terms of the recent advances, if you asked, if we look at surgical aspect, then there is something called as a lesser invasive surgery or a cosmetic approach, where certain types of heart defects can be corrected without opening the heart from the center. So the surgeon may either go via small incision at the lower end of the chest or at the back and try to create, cure that heart problem. So the good part about that is that the scar is not in the center, not in the front. So it's a very cosmetically appealing approach. Then there are certain heart problems which can be corrected with the help of a endoscope. So where the surgeon may insert a camera inside the chest, and through that camera then they can try and correct some of the heart problems. So then there are other newer approaches wherein surgeons are using certain kinds of grafts which tend to grow along with the patient's growth as well. So that helps in preventing further surgeries in the future. In terms of non-surgical aspects, if you ask, so the biggest advancement, if I have to mention about, is the transcatheter valve. So essentially, something which always required an open heart surgery is now possible without doing an open heart surgery. So these are the valves which we are able to put through the leg or through the neck inside the heart, which has made things very easy. Recovery is much faster. Patients are discharged probably on the second or third day after the surgery. So that's been one of the recent and a major advancement in terms of correction of certain of the heart problems without really entering the heart from outside. Yeah, so a majority of the heart problems, as I mentioned earlier, are correctable by just one surgery. and which may require follow-up for a very short duration, maybe for 4-5 years, after which we can expect that no further follow-ups would be required because we anticipate no further problems. Then there are certain heart problems which do require a long-term follow-up because there are certain minor issues which may come up as the child grows, especially when they enter into teenage and adulthood. So for that they need to be under follow-up. And third is the type of surgery where a lifelong follow-up is mandatory because we know that these are the problems these are the heart defects which are going to have problems in the future and which will require either a repeat surgery or at least a medical follow-up, so that to ensure that the patient is not having any major heart defect which can actually risk life.